Air pollution is becoming one of the biggest challenges to health. The World Health Organization, WHO, is warning that over 99% of the global population inhales polluted air, with low and middle-income countries suffering the highest level of exposure. According to Vital Strategies, a health research organization, over 25,000 cases of chronic respiratory infection due to air pollution are recorded in Kenya annually. Our reporter Opicho Chemtai brings you the story of how air pollution is pushing up disease burden in the country.
A large percentage of the population is not aware of the health risks associated with exposure to air pollution in the course of their day-to-day activities. The pollutants comprise fumes from vehicles, burning of waste, use of biomass like firewood and charcoal, and some particulate matters in the air. Akinyi Omolo and Mzee Jacob Bakoth have been fishmongers for the past 30 years. Even though they ply their trade in an open environment, continuous exposure to charcoal fire, boiling oil and frying fish has subjected them to some health complications.
Mwezi ya mafuta ilikuwa inanisumbua. Sasa ile ninaendelea kuchoma hapo ndani inanisumbua niko na shida kwa kifua. Tena sasa ile kwa moto huko unakoa sana juu ya mafuta.
Ingewezekana tupate hizi mashini ya kuchoma samaki ya stima. Hiyo ingekuwa mzuri sana 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 sana.
The situation is not different for Boniface Mbaka, a vegetable vendor.
Tunawaomba waweze kujitahidi na wakati watufagirie mazingira yawe mazuri, maana kuna watu wengine hata wengine ni wagonjwa, wengine wanakuanga na allergies.
While acknowledging these as sources of livelihood, health experts opine that their area of operation exposes the traders to air pollution and inherent health hazards.
Looking at our landscape, I think respiratory diseases are up there on the top. Of course, we have cardiovascular diseases. These are the biggest problem all over the world. So these are the leading causes of air pollution-related illnesses and deaths in this. Yeah.
One of the initiatives addressing the health hazards in air pollution is the Clean Air Catalyst program that was rolled out by the World Resource Institute.
We started the first few years, we were just building evidence and really understanding what is happening in Nairobi. So to do that, mainly we engaged researchers, academia and other organizations within the city that are working on this space to kind of gather the knowledge and understand what's really happening.
We are working with women as key clean air action catalysts. We want to engage them as key participants within the project. We also want to work with them towards decision-making spaces.
The 5-year program has engaged some youth in collecting data that will inform future actions.
To develop a monitoring network for Nairobi, where we'll be monitoring the air quality of the city so that we can give data to the citizens to understand the status of where they live.
By combining scientific analysis and community consultation, the Clean Air Catalyst focuses on locally tailored, cost-effective and sustainable air quality interventions that can help reduce air pollution and achieve health, climate and equity goals.
Private sector in Nairobi are willing and able to take action, but they need to get the support and they also need to be given the time to kind of make these transitions. And this is what we'll be focusing on in the next 2 years.
The National Environment Management Authority is calling for a review of statutes on air pollution to bolster litigation against culprits.
So over time, as we regulate industrial emissions, as we regulate vehicular and other mobile sources, we want to see where were we before and how much have we done in terms of progressing the quality of air in the country.
The people who are directly affected by the air pollution. So we are going to offer that assistance and support and ensure that this time round Nairobi must work and the things must be done in the right way.
When it comes to matters eradicating air pollution in the country, it requires a concerted effort from all stakeholders to end this menace. Reporting for Channel 1 News from Naivasha in Nakuru County, I'm Opicho Chemtai.